As of today, India is home to about 18,000 registered Rohingya refugees. But as India is not a signatory to the 1951 Refugee Convention, it lacks a suitable domestic framework to deal with refugees. As a result, all refugees are considered foreigners in India. In 2017, after the government of India announced its plans to deport the Rohingya back to Myanmar, there was a rise in discrimination against them, with increased hate campaigns and trolling across social media platforms. India's neglect towards the community has ensured that the basic needs, such as access to education and healthcare, are largely overlooked. The Covid-19 pandemic has made the situation worse, especially with India facing a second wave.
COVID-19 coronavirus.
Due to the coronavirus, countrywide lockdowns and curfews were being imposed. Schools, colleges, and most institutions were shut. This severely impacted the Rohingya refugees living in camps, who faced a lot of difficulties. Many of the Rohingya are now out of work, starving, and relying on aid. While there is a general understanding of COVID-19 and social distancing, there is also a high level of misinformation among the Rohingya. The fear of discrimination has adversely affected the community, to the extent that the Rohingya are now reluctant to seek medical assistance. This is where this project by Rohingya Human Rights Initiative, along with the COVID-19 Emergency Statelessness Fund, comes in play. It focused on developing material about COVID-19 and its impact. Using video materials and posters, it conveyed both the social and psychological impacts of the pandemic on the Rohingya community. With the help of participatory planning, the project has motivated 40 selected Rohingya leaders to raise awareness across 40 Rohingya settlements. The focus was on vulnerable groups, women, children, and the elderly. The project also held a small-scale distribution of hand sanitizers and masks, but the project was not without its share of challenges. Contributing to this is the current political situation in India. On March 6th this year, around 200 Rohingya refugees were arbitrarily detained in a Jammu prison, waiting to be deported to Myanmar. The Supreme Court rejected pleas to stall the deportation. Elsewhere, on June 12th, a massive fire broke out at a Rohingya camp in southeast Delhi, burning down the camp and leaving about 250 homeless.
दिल्ली में मधुपुर कादर में रह रही हूँ.
I live in Delhi, in Madanpur Khadar. We are very afraid because of the fire. There was a fire in 2018 too, and now in 2021, everything has burned. After this, we are very troubled, very distressed.
All this created an environment of fear among the Rohingya, affecting the community's participation in the project. However, even as the project worked hard to fulfill its aims, it recognizes how it attends only to urban and peri-urban areas. A growing concern is that Rohingya refugees living in rural settlements and isolated areas are the most vulnerable, as most aid organizations and humanitarian initiatives often fail to reach them. But they require urgent attention and assistance. For future projects, it becomes vital to extend the scope to rural and remote locations. This will create a change that is sustainable and one that will benefit the community in the long run.